Right now in the studio, I'm joined by the PS Minister of Health and alongside the Vice President of the Uganda Medical Association, Dr. Pauline Byachika, Prof. Pauline Byachika. Thank you, ladies, for joining me. A very good morning.
Good morning, Simon.
What a pleasure being sandwiched by medics very early in the morning.
And ladies. Ladies at that.
Dr. Twine.
Yes.
What are you picking from the ground?
Oh, what I'm picking on the ground is very good because most of the facilities are working. People remained working. And especially really the lower units, and even hospitals, regional referral hospitals, many of the hospitals worked yesterday. The services went on. Of course, some people did not come, but...
so there is no paralysis?
Not much, really. Not much. And even in Mulago, senior doctors, yesterday I talked to some of the senior doctors. They remained in Mulago, they were working. And so...
So who is striking?
Yeah, a section of the people who feel... You see, this is a free world. People must express disappointment and disagreement or whatever, but I think they have their right. But what I know that a big number of people have remained working and they are not convinced that this is the way to go because we are dealing with the lives. But also yesterday, what was good in the meeting, when we were meeting the doctors, a section of the doctors, they also agreed that the emergency services are going to remain. They are going to offer emergency services for those big hospitals like Mulago. But I think we are going to continue engaging them because even as government, we need to come up with a position.
Professor Pauline Byachika, you were part of the group that made this resolution to strike. Going by what she's saying, is there a sense that perhaps some of your colleagues have snubbed calls for a strike?
Thank you very much, Simon. So the call for the strike is a call from members of Uganda Medical Association.
To which she subscribes? To
which she subscribes. She is a member of Uganda Medical Association. So at the General Assembly yesterday, we discussed and decided, we presented an implementation strategy, and this strategy dictates that emergency cover should continue in all the hospitals. So we expect that those doctors who are working in the emergency areas are continuing with duty. However, all the other doctors have joined hands with the people who were at the meeting yesterday to lay down their tools to negotiate with government.
Was strike avoidable or inevitable?
The strike could have been avoidable, and we think the ball was in the hands of the government to really call off the strike. And as we said yesterday, we had a meeting on the 9th of October. And at this meeting, members of the association really portrayed and displayed their frustration. And this frustration is not only of yesterday. This is long-standing frustration from the medical fraternity, long-standing demotivation from the medical fraternity, from the doctors. Papers have been written as early as the 90s, 2000, early 2000s. There was a paper by Dr. Edward Kanyesije in 2013 that quoted the same outcry that the doctors of today are really portraying. So these things are not new. The government really knows about them, and I'm sure the PS here knows about them. The government supports the doctors. So today and yesterday, doctors are saying, let's negotiate. Let's see if you can give us something better. But more so, the outcry is for the work environment. The conditions in the health facilities are not good. And this is a benefit for the community.
What's most fundamental in all the demands that you're making?
So we have two major demands. One is to improve the work environment. Two, to improve the doctors' welfare. They're both fundamental.
Dr. Twine, is there a sense that these doctors are asking too much?
No, they are not actually asking too much. Their demands are well known, as she's saying.
And their demands tenable?
At the moment, government is in the process of doing salary review. because you see, doctors are not an isolated island. They are working in the same setup as other government workers. You know, recently even teachers went on strike. The prosecutors went on strike. And because of this general dissatisfaction in the public sector, the president constituted a committee that they go through all the salary structures of the government ministries and public service, and they come up with comprehensive recommendations. And those recommendations, once they are presented to cabinet and they are passed, then they have a review, a salary review, comprehensively. And this was expected to take place at the end of November. Therefore, for us to say we provide a solution right now as we are waiting for the recommendations of the committee, it is premature. And the president met us about 2 weeks ago. I think it was the other week. She was there. She was with us and other doctors of Uganda Medical Association, and we went through and he explained and he told them this is the process.
He told them the money is there.
No, he said that we cannot handle piecemeal of doctors because I have instituted this committee. They are going to do more analysis and they will come back with our the recommendations which we are going to employ or discuss in detail, and then we come back to you with us.
Do you get a feeling that there could be something motivating these medics to go on strike?
Well, I wouldn't know the motivator, but I think at this time we think it is just much more than the demands. I think some people are employing some other tactics for their own gains, because all these things, by the way, we have been engaging doctors. It's not really that we've been quiet. We've been engaging doctors. We've been meeting with them. And for example, the working condition she's talking about, government has made a deliberate move. If you visited hospitals about 10 years ago and now, I think government has invested a lot in making sure that they expand, they put infrastructure. Now, what remains is to make sure that that infrastructure is optimally utilized. Because we see in some equipment still lying idle in our facilities where we have put equipment. So we are, my colleagues know that you cannot wake up in the morning and all of a sudden everything is there. We are moving step by step, and they are part of this, and they are seeing what.
So they are being insensitive.
For example, in Mulago, if you go to Mulago, the infrastructure that is being put in place, and once that hospital opens, it will not be the way it was, so many years ago. The structure, we are doing restructuring, we are training more workers, we are equipping. We have bought equipment. If you visit all these hospitals, the equipment is there. So what needs to be done is for us to harmonize our thinking. Where do we want to go? What is our next priority? What is our next priority? And we had even been communicating to the workers that the human resource in our next investment, because they were saying, you cannot train people and they come and they don't have anything to use. We must first put things in place. You train doctors, then now you handle the human resource issue. And I can assure you, as I talk now, this year we have taken on more scholarships than never before. This year, the number of people we are training, the people we have sent out of the country, the people we are supporting internally to do specialized training, so that we build this human resource you know, step by step. You can't wake up in the morning
if I could
and
just
you
hold
have
you there.
everything in
Are you
place.
simply being blind to all the efforts that government is putting in place to better your services?
Thank you very much, Simon. And I would like to thank the PS for having stated that. We are not saying we are not grateful to what the government has done. We are extremely grateful to what the government has done up to now. But we are saying it's not enough. We are saying the equipment is not in some facilities. And even in those facilities that have some of this equipment, it works 2 days and it is non-functional for the rest of the month. She gave an example of Mulago National Referral Hospital. I work in Mulago National Referral Hospital. And I must tell you that for about 3 months, about a month ago, for a period of about 3 months, we had non-functional imaging. We could not do an X-ray, we could not do a CT scan. Patients had to send, even the labs, blood investigations, the blood tests. We had to draw the blood, put in a tube, give to a patient, take to a private lab outside. So we are saying, yes, the government has put some of the equipment in place, but it's not enough. The patient is still suffering. If I want to make a diagnosis, I cannot make a diagnosis in a public hospital today.
You put
it's not very, it's not
a very despicable situation of the health system in the country.
Simon, I must tell you that some doctors have given testimonies of where a doctor has had to use razor blades to carry out a cesarean section because they did not have the necessary equipment to do the cesarean section. So we are not saying the government hasn't given us anything at all. We are saying the government has given something, but it's not enough. We are asking for more.
Is it too little?
And it's too little. We're asking for more. And actually at the meeting we had with the president, we told the president all these concerns, and he supported us. He was in agreement. He actually stated that they are directors of incompetence in some of the facilities, directors of incompetence in some of the ministries. He does not understand why some of this equipment is not there. There are places where equipment has been put in place, but there's no human resource to use the equipment.
What would motivate you to go on strike when the other party that you're calling on to help you looks willing to assist and to intervene?
So,
couldn't you hold?
Like it was stated yesterday, the other party is willing to assist. But as members discussed yesterday, they have sung the song of willing to assist for a number of years. And doctors are saying, we have not seen it come through. We are not able to survive. For example, a medical officer surviving on 1.1 million shillings today in Uganda today is quite difficult. The interns are crying out. They're saying we are sleeping in slums. An intern says, I left duty last night. When I reached home, everything in my house had been taken because I'm living in an insecure environment. So the interns, the doctors, the workers in the health facilities are saying, government has done something, but it's not enough. And when we say it's not enough, government says, yes, we are negotiating, but they're not seeing, you know, the breakthrough of the negotiation.
Well, Dr. Twine says there could be more than meets the eye in this strike. It's not merely about these demands. What do you make of this?
Sincerely, I do not agree with the PS, Dr. Diana Atwine. I do not think there's anything behind the strike. The strike is purely a doctor's strike. She attended the meeting yesterday, and our president, Dr. Obuku, announced that the strike is not in any way linked to any politics, any political party. It is purely a doctor's strike. Doctors just raising their voices, giving an outcry for improved work environment and improved welfare of the doctors. Purely that.
Is a strike sustainable under the circumstances?
Under the circumstances, I think the strike could be sustainable. I have already had thoughts and messages coming in of some other health workers who are not doctors wanting to join the strike because they also realize that they could also benefit from the strike. And if the community, yesterday you saw on the TV that, say, for example, Iganga Hospital was paralyzed. The patients were crying. Patients are saying, why can't the government help these medical doctors for once? And they come back and help us. So the strike is sustainable because the community is with us.
Dr. Twine, can there be anything in the interim to resolve the current deadlock?
No, but as I mentioned earlier, we have been engaging the doctors, and we are going to continue. Of course, even I remember when we were
What
in
kind
the
of
State
engagement,
House,
if I could take you on?
engagement to look at the demands and saying this, there can be short term and long term. The salary is a long term because we must wait. It's not, you don't wake up in the morning and you say, because first of all, Minister of Health is not working alone, is working with other government agencies, Minister of Finance, Health Service Commission, Public Service Commission, Public Service, local government. So we are not really sitting like we are just talking, but behind scenes, the work is being done, and the discussions and the reviews and all that, what we are talking about, like salary review, is going on. But I think also we need to come to a meeting point, both of us, and agree, because really lives is not, it's not like this piece of paper.
Do doctors have a good case to go on strike?
They have a good case, but you see that the issue is all the answers have been, we have told them what government is doing up to the highest office, and their main concern actually is salary. That is their main concern, and we are saying government cannot come up with a pronouncement now until that salary review is done. But also, what came out clearly in the meeting is that the nurses, the clinic officers, the other people were left out. They were not negotiating for them. We are saying this thing must be more inclusive, not just Uganda Medical Association, because also nurses are not being paid well, the clinic officers are not being paid well, the lab people are not being paid well. So why are you just singling out doctors alone?
Dr. Tina,
So
I want to go to Samson Kasumba, who is at Mulago Hospital. But before I get there, Professor Pauline,
Yes.
how unanimous is this strike?
Now, this strike, as I mentioned earlier, is a doctor's strike. The rest of the health workers have not joined yet.
Okay.
But they are planning to join.
Okay.
Now, Dr. Atwine mentioned,
if you could just hold on.
Okay.
Let's go to Samson Kasumba to give us a picture of Mulago Hospital. We just want to tell whether work is at a standstill or it's business as usual. Good morning, Samson. Give us a sense of Mulago Hospital.
Good morning, Mr. Simon Kagwanjala, partner in live broadcasting and, of course, from the Political Command Center. I am inside Mulago Hospital. The weather is very good weather for the farmer, certainly not the kind of weather for the journalist. That strike is still going on. Coming into here, came through the medical school, and, of course, many vehicles are parked there. But right here, of course, there's a bit of traffic because you understand that the construction and renovations here continue to be a constant feature. So there is a blockade on the other side, but many using this route. I spoke to a few persons in their white gowns, asking them whether they are going to work. But I'm told here in this building, has been around for some time. 1945 is the age of the building here. It has a very fresh coat of paint. Cleaning going on here. I'm told that inside here there is a medical staff who was on the night, and cleaning is going on here, as you can see. Let me try to find out what the situation is inside here, if you can come with me. The patients, of course, inside their beds, Simon, and as you will see in a very brief moment here, there's quite some very interesting painting on here. That means it is probably very much associated with children. If you can see from the first shot here, I'm told those who worked at night, at least one who was on duty for the night, is still here. I think some doctors who have taken that Hippocratic oath insist that they will be working, if for no other reason, at least to make sure that Ugandans continue to get healthcare services. Simon.
Well, Dr. Diana Twine is here saying thank you. Could it suggest that perhaps it takes some gut for anyone to remain in the hospital while others are on strike.
Simon, it is raining here. Can you just give me your question again a little louder, if you may, sir?
Well, I was simply conveying the compliments coming from Dr. Dana Twine towards that doctor who stayed on duty regardless. Does it in a way suggest that other doctors have chosen to remain home?
Well, Simon, these things are very much about how one understands their calling. I wouldn't say that those who have decided to work do not believe that the conditions should not be changing. But you see, it's about how one sees their calling in terms of treating those who actually need treatment. The fact that some has worked does not, in my opinion, suggest that things should not be changing. But whether the government sees that in whichever way government sees that, I think even those who are working, when you talk to them, they say, yes, we are working, but conditions should certainly change away from the status quo. Simon, it is a very rainy, interesting morning. But being here, of course, continues to make those of us who are into journalism ask questions. How come our healthcare is still where it is 55 years after the British left?
Good question. And I'll leave it at that and get back to Professor Pauline Biachika. Medical profession used to be characterized with nobility. And it was unheard that a doctor would go on strike. What happened?
So, yes, the medical profession is still looked at as a noble profession. It's still a noble profession, and that's what we are crying for. We are saying we are noble. Doctors are noble.
Is there nobility in striking?
Yes. Now, let me take you on that one. Regarding the ethics of medical workers, yes, doctors swear the Hippocratic Oath, and we swear to save life. But doctors do not swear that they're going to live in utmost poverty to save life. Because you cannot save life if you yourself, your life is at stake. If your life is in trouble, you cannot save another person's life. We also know that health is wealth. If you don't invest in health, you will not have the wealth. So back to our ethics. The ethical code of conduct does not say that we should work under very difficult conditions, that we should work with very poor remuneration and in very hard environment. Dr. Diana mentioned the salaries. Yes, we are pushing for betterment, improvement in the salaries, but we are also saying, can we have some duty facilitation allowances? This
Did they exist before?
Yes, a few of the salary allowances exist before. A doctor gets a lunch allowance of up to 66,000 shillings a month. Simon, how much food can you buy with 66,000 shillings a month? A plate of your food for lunch, I think, costs more than 10,000 shillings.
So a doctor eats 2,000 shillings for lunch?
Per day.
Okay.
To take them through the whole month. So doctors are saying, we work on public holidays. We work after 5 p.m. We work on Christmas Day when everybody is out there enjoying their Christmas. We are called at night. We drive from our homes or take a border to go attend to emergencies in the health facilities. And they're calling on the government saying, our dear government, can you facilitate us better? We really want to work. By the way, doctors are...
Do you appreciate what's in the national pass before you press for more?
Yes. When we spoke to the president, I really appreciated the president's lecture. He took us through a lecture of economics. He took us through where the country came from, right from 1996 to where we are today. He took us through the tax collections. He took us through the revenue. He took us through a lot and really showed us that there is some good amount of money now. At the end of showing us that there was some good amount of money collected now, we clapped. We were very happy. And he said, no, that's not for paying salaries. So we are asking the president, our dear president, could you please look into that budget and facilitate the doctors a little more? Because we know health is wealth. He is interested in middle income status for this country. He's interested in development. But we are saying, without health, we shall not get the wealth that you're talking about.
Do you feel overstretched?
Oh, many times I feel overstretched. Because let me take you back to where I work. I work on an infectious disease ward. And my ward at any one time has more than 60 patients. I run that ward with one nurse on duty. How can one nurse on duty look after more than 60 patients where half of them are unconscious with one doctor on duty? So we have to do a ward round, go through all these patients. At one time, I asked the nurse, I did a ward round, and less than half of the patients had received medication. Half of them were unconscious. I asked the nurse, how come these patients have not received their medication? The nurse told me, doctor, I slept hungry. I walked to come to work. My children do not have school fees. And I am hungry at the moment. I think I have done what the government, what the government pays me for. Right now, I am tired. I looked at the nurse and I couldn't say more. I couldn't force her to get back to give out the medication, to administer medication to the patients, because she had expressed her concerns to me. So many times, health workers are overstretched.
Dr. Diana Twine, is Uganda's health sector in a very dire situation?
What she's talking about, like in Mulago, on medical ward, having one nurse, I think it may not be really accurate that they employ one nurse. Sometimes, actually, some people don't come to work. I can bring statistics on medical ward. The nurses that are employed on medical ward, the nurses, the list, I can bring. We have all these statistics. But when she says that only one nurse, then that also tells you that there is a problem. Because if you are supposed to be 5 nurses on duty and you have only one nurse, already that tells you...
Yeah, but her revelations are painting a dire picture on the state of health.
So I think all of us have a role to play. For me, what I would want to say is we acknowledge that it is high time, actually long before now, that our workers are paid well, because I'm a worker, I know, I'm a doctor.
Thank you very much.
But I want also to thank, and really we want, on behalf of Minister of Health, want to thank all the doctors in Mulago. We want to thank all the doctors in regional referral hospitals. We want to thank all the clinic officers, the midwives, the nurses that chose to continue to save a life as we wait to have a solution.
Yeah, but
I really want to thank
the strike has been long overdue. You agree?
Yes, but that's still our obligation to save lives come first. Exactly. And I know
Can you save a life on an empty stomach?
It's not empty stomach. It's not. I think that is like
exaggerated.
Yes, because for sure we know that government has been a bit lenient and closing one eye, allowing doctors to work in their private clinic, to top up. That's why people, when you go to Mulago, you will not find consultants full-time there. And of course,
the argument that they are poorly paid is flawed.
Is not really purely that someone is working on an empty stomach. I wouldn't want to believe that. Okay. Because that is like an extreme. But for me, what I would think is that because government has not closed the door, government is saying, we understand your plight. We are working on this. If you are talking about improvement of condition, this is what we are doing, and everyone can see that with open eyes, because surely if you go to Mulago, you will be able to see what is being done. Now, when a machine breaks down, that is a managerial issue at the facility. It has nothing to do with... So that is a managerial issue. Like yesterday, someone saying, someone was putting on gloves in their feet to operate because they didn't have gumboots. I said, that is ridiculous. Because we send PHC to facilities, and the PHC is to help organizers or the management to prioritize. Surely, how can you fail to buy a 10,000 gumboot for a doctor to put on when he's going to theatre? So you can see that the priorities of some of our people need to be changed.
Is their argument having some bit of deception that things are bad in the health sector?
No, they are not that, like people coming to work.
They are being alarmist.
Stomach, or one nurse. Or, no, that one is.
They are being alarmist. If you were on the other side, would you have gone on strike?
But I was with
No. If you are on the other side, would you have gone on strike?
If I would not have. I would not have gone on strike. I would not have. The reason is, if clearly in my heart, I know that, even now, by the way, when you go to Mulago and you talk to senior doctors, they are working. They are there, they are working. They are not convinced. They think.
Or Professor Pauline
They think.
Government has been so tolerant towards you. They allow you to moonlight, and then you come out and start complaining.
You got
Thank you very much,
you
Diana, for bringing out that. Let me tell you, Diana, if you were into clinical practice and you had to work in a public hospital, but because the salary is not enough, you cannot pay school fees for your children, you have to run from clinic to make ends meet, I think you would not be happy. The doctors are saying,
they are not
we
happy,
do not
of course.
like the situation we are in, working in a government facility because I need that little salary, but because it's not enough, I have to move to IHK, I have to move to Nakasero, I have to move to Jinja, a clinic somewhere in Jinja in the evening or on the weekend to make ends meet. No doctor really likes that. A doctor wants to come to work in one facility,
I agree with
give
you.
their best to the patient in that one
I
facility,
agree.
and go home in peace. Right now, when we see patients stranded, we are touched and we want to go back to work. But we are saying, should
Are
we
you
go?
touched?
Very touched. Yesterday, I almost shed tears when I saw what was happening in Iganga Hospital. Yes, I want to go back to work. But at the same time, I would like to be seen as part of every other doctor trying to negotiate with government to say, please improve the work environment, please improve the doctors' welfare.
We are doing
now, Dr.
that.
Diana Atwine,
We are
That's what
doing
they are doing.
exactly
yes,
that.
Dr. Atwine mentioned that she does not believe that staff are not enough on duty. Let me tell you, Dr. Atwine, yes, we may have 6 nurses on the duty roster, on duty, but one is for morning duty, day duty, the other is for evening duty, the other is for night duty. One is on annual leave, the other is on sick leave, the other is away on training.
I promise I'll bring the whole list of nurses.
So they are absent, simply.
Let me say something. So they are
I'll bring
present,
the list.
but some are on annual leave, they are entitled to their annual leave, some are in meeting,
I'll
some
bring
are in
the list.
training. Then you find that you have only one to take care of those patients.
I'll bring the list.
Let me tell
to
you, a lot has
demonstrate
been talked
that.
about absenteeism and presenteeism. Absenteeism, I have I've categorized for you the factors that really are responsible for this absenteeism. But what about the presenteeism? You're there, but you're not really there. Because 1, you're not motivated to work. 2, you do not have the facilities to use to work on the patients. You're not going to work on those
Let me hear this again. Some medics are present, but they are not there.
Yes, they are present, but they are not actually present. Presentism. They are there, but they are not working.
Presentism.
You've had the long-term statement that doctors have given, saying, if the government pretends to pay us, we shall pretend to work. Dr. Atwine knows about it. She practiced with me in Mulago when she was an SHO, and she had these statements, and she knows exactly what happens in those facilities. So we are saying...
Isn't government being sincere in their narrative that they're doing a lot, and you're simply failing to appreciate?
Now, doing a lot is relative, Simon. According to government, they may actually be doing a lot. But according to us, the receivers, the end users of the service, and people actually doing the health clinical delivery in the health facilities, we are saying, no, it's not yet enough, and we are asking for more. She talked about the doctors being out of the facilities. And we are saying, yes, Dr. Atwine, we agree with you. And we are saying enough is enough. We are churning out hundreds of intern doctors. This year alone, we have more than 1,000 intern doctors. So we are saying if the senior doctors are not in the facilities because they have to moonlight in their clinics, who is training these interns?
Before I get
Who
to
is
Dr.
supervising
Atwine,
them?
before I get back to Dr. Atwine, and then we'll take a break, are you mindful of the consequences of this strike? The president announced, reportedly announced, that he would declare a state of emergency and arrest all of you. Are you ready for this?
That one, I don't think we'll do that.
Simon,
Are you ready for this?
I do not think
You were in that meeting.
Simon, let
You
me
were
say
in the
something.
meeting.
Yes, I was in the meeting, but I don't really think that the president meant
No,
he's
he
actually
was
going to arrest us.
misquoted because that was intention still of misquoting the president so that they caused this alarm.
No, he mentioned it, but
yeah,
he
but
mentioned
it was
in
just
passing.
like
he mentioned
joking.
it in passing.
He
Yes,
didn't mean
I
that.
could say probably.
What if he meant
did not
it?
mean it?
No, he didn't.
Simon,
mean
how
that
many
one.
doctors is
He
the
didn't
president
mean
going to
this one.
arrest? The lecture theatre was packed to capacity yesterday. Is he going to arrest all those doctors? He said, yes, I will arrest you and force you to go back to work. But we are saying, Mr. President, how will you force me to perform a cesarean section?
Does anything await this strike?
No.
Because it is sheer indiscipline, isn't it?
But no.
It is unethical to strike.
No, it is not unethical. People have the right really to express their dissatisfaction. But what I still want to come back to is that government is fully aware of the challenges that the doctors are bringing out. Government is taking steps. Therefore, the strike is not called for now. Well, because we have sat with them, we have even told them the steps that are being taken, and they not definitely, maybe people, because most of these people in Uganda Medical Association who are agitating for this are not directly employed by government.
Oh, really?
Yes.
Simon,
so maybe
are these imposters?
No. They are doctors, but they are not in real, real establishment. So maybe they may not appreciate some of those intricacies of how, the bureaucracy of government, budget process. You must wait. You must sit and go into the budget.
So Obuku and the group do not work in government facilities? No.
Obuku is not a government worker. And a number of them are really not government workers.
I think that's
so they may not really appreciate those government issues. But still,
where do you come from?
Thank you very much,
yes.
Dr. Twine. I think Dr. Twine was present in the meeting yesterday. And as I said, the lecture theatre was full to capacity. And all these doctors stood up and said, we are going for industrial action. It was not Dr. Obuku's statement. It was the doctors in the lecture theatre. Actually, it was overwhelming support. I don't think anybody said no industrial action in that
But it's strange. The ringleader doesn't work in government facility.
I'm wondering if Dr. Atwine thinks that all those doctors who are in that lecture theatre do not actually work for government.
No.
We, the leaders of Uganda Medical Association, were voted into office to lead the Uganda Medical Association. Now, in one of the meetings, members raised their dissatisfaction, demotivation, and said, we move a motion to go on industrial action. So the leaders cannot simply suppress the feelings of the majority of members of the Uganda Medical Association.
Obuku and others who do not work in government facilities cannot appreciate what Dr. Diana Twine and government are doing.
I think when Dr. Obuku stands up to speak, he's not speaking about himself. He's not portraying his own opinion. He's speaking on behalf of the association. And repeatedly yesterday in the meeting, he repeatedly asked members in the meeting yesterday, am I representing your views? And members stood up and shouted, yes.
Dr. Twine was there. Dr. Twine, you have a point to make here.
No, I think what I was bringing out is that, for example, the union that represents the interest of, is missing out. Dr. Buku, who is not a government worker, and many on those committees. And actually, what he's saying, yes, people were there, but they were mobilized. They were mobilized to come in that office, in that hall.
The meeting has to be called.
Are they medical officers?
And so they are. Some are interns. Actually, the majority there were interns and SHOs and some doctors. But what I'm saying is that sometimes you need to understand the government processes. Because what she's saying, that I remember even yesterday they were saying, until our money is there, until they pay us what they were asking for 5-bedroomed house, 43 million, blah 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 per consultant. So we said
outrageous
no.
demands.
So why don't we agree that you need to be paid? But these are the processes that we are taking. And you are going to be part. Actually, the president told them that you go and take your suggestions to the salary review, so that your views are captured, so that as they come to make a presentation to us, they have captured your opinion.
Could there be politics in this strike?
Of course.
Okay.
Anyway,
we're taking a very quick break.
I am not going to go there, but I know that
there is politics.
That one's a big one, a big component of it.
Okay, we are going to take a very quick break and return.
That one
shortly.
I know for sure it is.
Welcome back. You're still watching the Morning Breeze on NBS television. Well, it's getting hot and interesting. Two doctors are in the room, not roasting themselves, but debating something that is very crucial for the nation. Dr. Diana Twine, you are in charge of medics in this country.
Yes.
It looks as though you've lost grip. You can't get them back to work. That is strange.
No, I'm not alone, apparently. As government, all of us have a particular role to play. Public service has a big role to play. Health service has a big role to play. Public Service Commission has a big role to play. Finance, local government. We are together. It's not just an individual that I'm in charge.
Yeah, but you have the whip.
But we are going to come up with a statement very soon as government concerning this situation. And I think that the decision will be made on how to move forward.
So for now, do you let the patients rot away? Do you let them?
No. They are not rotting away. Apparently, they are not rotting away. And I want to assure the listeners and the viewers that patients are not rotting away. They are receiving services. Many facilities are working. A number of
but our
doctors are
assessment
working.
shows that patients are stranded.
Now,
who is feeding you wrong information?
But I've been in touch with a number of facilities. They are working, and we are going to reach out also to a number of people through different fora, and we think that a number of people actually appreciate the steps that we are taking.
Amicable solutions have failed. Yesterday, I saw the kind of treatment you received. It was very hostile, and you walked out in resignation.
It was hostile, but that is only for the section of that team. No, it's not everyone that is hostile.
You seem to brand this as a clique. This is a clique.
No.
Yes, it is.
It is not.
There are a number of people who are working. Even now when you go to Mulago, you'll find people working.
So there are stubborn elements.
When you go to Mbarara, you find people working. When you go to Mbali, people are on the wards working.
So these who've absconded from duty, what awaits them?
Of course, I cannot say here what government is going to do, but we are yet to see it and look at the magnitude of the problem. And we come up with the statement.
Professor Pauline, can anything compel you to go back to work?
Oh, yes. And that is what I'm asking. We are asking the government to do. We are asking the government to compel us to go.
No, they're going to crack the whip on you.
No, we don't have to.
We are asking the government, please, give us some tangible outcome. Give us some tangible.
Can I promise what?
Like what?
As long as it is written and signed with.
But
with
this
the
is
date
what
and
PPS did yesterday.
What
I was
PPS did yesterday was to write a kind of summary of what transpired in the meeting with her.
Exactly, and it was saying that.
So he was communicating minutes of the meeting.
Yes. Now, what the president said in the meeting we held with him, then I was there, and I'm very happy that we have Dr. Atwine here with us, and that she's the PS, because she knows exactly. She has gone through the system. She's my OG, by the way, and we have studied together. We have walked this walk together, and she knows exactly.
And you're now parting ways.
No, we are not negotiating. We are not parting ways. And I'm sure, Diana, we're not going to part ways. We are negotiating.
No. That's why.
She knows exactly what is in this facility.
That's why I'm
when
saying.
we met the president clearly stated that he has been telling the people in charge of salary review people, that the lowest paid medical officer should earn at least 5 million. But he said they have let him down.
So the president is with you?
Yes, the president is with us.
Who is against you? Who is against you?
I don't know if Dr. Atwine is against us.
No.
Since she's saying there's a clique, maybe she's against us.
But you know that I am the one who took you to the president. If I was against you, I would not have taken you to the president.
Dr. Atwine is with us, and we are negotiating. It's just like when a husband and wife disagree.
So you sympathize with the striking doctors?
Negotiate and come back to work.
No, I don't sympathize with the act of strike. I sympathize with the demands. And we are saying government is not indifferent, is working on it. But I don't agree with the act of the strike. That's the difference. That's my my difference with them.
Dr.
What
if
they
you are
are,
working in
they're-
these appalling conditions that she's highlighted, would you really be proud to call yourself a
A
doctor?
doctor in this country.
There are many, many, many doctors in this country. Isn't she proud to be a professor?
Oh, I am proud to be a doctor.
All of
but
us are
at the
proud
same
to be
time-
doctors.
At the same time,
All
I
of
am
us are
saying
proud to be doctors.
I want to be where
So,
the profession needs
She's
to
working
be.
painfully.
I'm working
and you're
painfully
working comfortably.
in the air-conditioned office.
That is not true. You don't know how much work that I have to do in order to keep all those things working.
So you are equally constrained.
Yes, I'm equally concerned. And let me tell you, maybe you guys, you need to be part of us when we are making budget. And we invited them. We told them, come and be part of us when we are doing the budget. And you see what goes on. Because you see, it is easier to stand on the, like when you are not in the field. Say,
They're
kick
on
the
the
ball,
fence.
kick the ball. You people, you are not kicking the ball. But when you come and sit there, and you see the exchanges, the cutting, the what, then people will appreciate, because they simply they have no idea.
So you are equally working in despicable conditions.
Not despicable, but I am pursuing my goal of making sure that health sector improves, the service delivery improves, the workforce are well motivated.
So there is work in progress.
Yes, but you see, you move step by step. You cannot wake up in the morning and perform a miracle. We are not magicians. That you shall drop the paper and all of a sudden everything turns into money and we pay. We are moving step by step until we get there. We have got our strategic plan that we are pursuing. And this strategic plan, one of the things is to make sure that our doctors, eventually, we have a well-trained workforce, we have a well-motivated workforce, we improve the working. Those are there, but you see, it all depends on the resource envelope.
Okay.
When you are given this cap to feed 20 people, you must see where do you put
Are all these ambitions in near sight, or they're about 10 years from now?
No, they are near. That's why we are saying November 30th, the salary committee is supposed to present their recommendation to the cabinet. After that, the cabinet is supposed to come back to us. We cannot implement without...
Oh, Simon, it is not shameful, because we have not yet had anything documented, anything tangible out of this. And that is why the doctors are saying.
Oh, these are rhetorics.
Yes. Yesterday, the Workers' MP, Honorable Lyomoki, told us he listened to the feedback we gave from the president. And he said that song has been sung for the last 31 years. Can you ask the president to sing a different song? And that's what we are saying. Can we have something documented? Something that, yesterday, Professor Maswa told us how he performed a job evaluation way back in early 2000 or the 90s, 1996. And this job evaluation showed that the PS should be the Director General of Health Services should be the highest paid civil servant because of that position. And indeed, his salary was increased to more than the PS's salary. So doctors asked him, how much was it? And he couldn't say how much it was because it was a very low figure. So he just kept saying it was more than that of the PS. So doctors told him, Professor Maswa, we would like to achieve what you did not achieve. That is a better amount in terms of figures for the salary of that cadre. So back to what Dr. Diana Atwine said, that the senior doctors are in the hospitals working. Dr. Atwine, yesterday we agreed that emergency cover shall continue through the first days of the strike until we hear from the government. So the areas that she's talking about that are being covered are the emergency areas. No doctor will allow a woman in labor or a woman needing an emergency cesarean section go without care. No doctor will see a collapsed patient, an unconscious patient, or a child with severe asthmatic attack and not treat that child. We are going to continue providing the emergency services.
Do you feel government is feeling your pinch?
Government is feeling our pinch, and I can see that Dr. Atwine is feeling the pinch.
Are you feeling their pinch?
Of course, our people are not getting the other services they need.
Yes.
Definitely, we are feeling the pinch. But also,
so that means the strike is biting.
Our hands are tied to say what she's saying, that we want a written. How can we how can we communicate to I don't know whether we call it Uganda Medical Association or to all the fraternity, the medical fraternity, that now we are going to pay this amount of money because the salary review that was put in place is doing all that, because state attorneys must be paid, army must be paid, police must be paid, teachers must be paid, and they will come with a comprehensive. So we are saying, why can't you wait? Because this process has been ongoing even before the strike was called on.
So you can't.
But Dr. Atwine,
so you can't commit yourself.
Because I cannot commit. How can I? On what basis? Because I cannot. I can say the government is doing this, but finally the final figure. Because even the president, when we met, he was saying, at least if the entry point of the doctor can get 5 million.
Yes.
That's what he said, and he put it in the letter. This letter they read to them. So what else do they want us? Me, the permanent secretary, should I say, okay, doctors are going to be earning 20 million. In case it changes, we shall come back to you. You understand? we must wait for the communication, because official communication.
Do you recognize the Uganda Medical Association? Do you recognize them?
It is an informal group of doctors association which I belong, but of course it is not a legal organization.
Entity.
Yes, it is not a legal entity. But it is just an association. So like how you form a club and
so why would an illegal entity hold that ransom?
It is legal. Dr. Atwine, Uganda Medical Association is legal. It is registered. It is legal.
It is not registered under the trade union. The trade unions actually are the ones that are supposed to advocate by law.
Now, you talked about the workers' union, the medical workers' union. The medical workers' union is almost non-existent as we speak today. So it is almost non-existent. It has several wrangles and almost non-existent, Dr. Atwine.
I'm afraid I don't see anything in sight in the near future.
It is there.
You look belligerent, and so does the government.
So Simon, you talked about we not caring for those patients, and
Yes,
Dr.
and
Diana
we
said
have to
if she was one of us, she wouldn't go on strike. Dr. Atwine, I would like to assure you that yes, medical profession is a calling. But medical profession, the calling doesn't say you remain poor and you serve the patients in desperate conditions. We are still willing to go back to work, but we want to go back to work and give the service that these patients deserve, the service that the community of Uganda deserves. We are having unnecessary deaths, preventable deaths because of the work environment. Nobody asked me to work in a government hospital.
She's by the way.
I'm teaching, and that is why I'm in this thing, because I teach students in the government facility, but I don't have the facilities to teach them the medicine that I want them to learn. And the president agreed with us. He said he wants us to have, that the Uganda Medical Association has only 6,000 doctors. He wants us to go back to him, telling him we have 80,000 doctors, and he's out to produce more doctors. But how shall we produce more doctors if we don't have the training facilities? At the moment, we are practicing what we call bush medicine. And Diana knows that. We always talk about it in the hospitals, that we are practicing bush medicine. But we want to practice good medicine, and we want to train the doctors.
I'm afraid we cannot exhaust this. Simon Muyanga Lutaya will be in with his contemporary Tamale Mirundi discussing state of affairs. Good morning.
Good morning. Thank you.